Hi, good afternoon. Today, I'll be presenting on the Safe Party program, which was developed to reduce injury accidents at New South Wales Music Festival. I'll first begin by describing the issue that is being addressed by the project with rationale and justification for managing the issue from a public health perspective. As you can see on the screen, New South Wales Music Festival's patrons have high rates of illicit drug use than the general population. Reports from New South Wales Health suggest that electronic dance music festivals were associated with high risk of psychoactive substances like MDMA, LSD, and cocaine, resulting in serious medical presentations of drug toxicity. Alcohol consumption is also high, and when taken with stimulant drugs, this leads to increased drug intake and high risk of overdose. Certain behaviors associated with music festivals also pose high risk of injuries, including moshing, an act in which patrons push or slam into each other, and crowd surfing, an act in which patrons are passed overhead from person to person. Environmental factors like high ambient temperatures and humidity and exposure to direct sunlight exaggerate alcohol and drug-related harms, while crowded dance floors often lead to heat stress. So the Safe Party program will guide harm reduction interventions and risk management strategies tailored to music festivals. Now, why are we planning the project? So due to the planning and due to the physical and environmental risk factors associated with music festivals, organizers need to prepare adequately to mitigate these risks. The Safe Party program will support organizers in running safer events and reduce health risks to patrons. In addition, harm reduction programs in these environments reach a wide subset of priority populations, especially young people who experiment with recreational drugs for the first time. This will provide an opportunity to raise awareness, potentially disrupting drug use pathways. And now I will interpret recent data from literature to support the need to address injury at New South Wales music festivals from a public health perspective. A cross-sectional survey in Australia found that 52% of music festival attendees use illicit drugs at least once, significantly higher than the general population. And symptoms such as drug toxicity, overdose, seizures, and hyperthermia are very common. And deaths from drug overdose have also been reported. Ice and cannabis were the most used drugs. Alcohol consumption. About 94% of young people in music festival reported consuming alcohol previously at levels above national guidelines. Alcohol consumption is becoming increasingly normalized in music parties. Binge drinking behaviors are very common. Sexual health, 21% attendees reported having sex without condoms on festival sites. There were 32,000 global reports of sexual assault in music festivals. Sexual promiscuity and needle sharing behavior for drug use often leads to spread of sexually transmitted diseases. Exposure to loud sound. This often leads to temporary or permanent hearing loss or tinnitus, which is ringing in the ears. And apart from that, there are also some environmental factors that affects injuries. For example, high humidity and temperatures often lead to exhaustion and dehydration. Prolonged exposure to direct sunlight increases the risk of sunstrokes and also cancers. And lack of emergency vehicle and medical services reduce the ability to facilitate urgent transfer and response where required. Now I'll use this data to support the need for intervention. So disparity in prevalence of substance abuse among festival goers reflect the vulnerability of this group to poor health outcomes. According to the equity principle, this should be targeted for education and harm reduction to reduce the gap. Because a large proportion of the attendees are young people, there is a unique window of opportunity to build preventative efforts in minimizing uptake of drug and alcohol to health promotion activities. And because the health issues are varied and has distinctive determinants, engaging with multiple healthcare stakeholders is essential, which can be difficult without a coordinated public health response. Now I will critically analyze the data. So we found that the quality of data was between average and low. Most studies were limited by convenience sampling, resulting in the data lacking external validity, which is not, which means that the data might not be generalizable to all festival goers. And self-reported data might have affected the internal validity of findings due to social stigma around drug and alcohol use. And there was also a lack of randomized controlled trials supporting the need for more robust research methodologies. A number of information gaps were also identified. LGBTQ-based music events report extremely high violence and injury, yet little has been researched to mitigate risk associated with these programs. Most of the findings are based on male respondents, leaving a gap on strategies that could be targeted towards the safety of women. And I do believe that further studies are required on the attitudes and behaviors of migrants and young international students in music events, as they are a priority group for drug and alcohol prevention of New South Wales government. Now we will have a look at what can be done to address the issue. So the program logic model has been used to prepare the intervention, activities, output, and impacts, and outcomes associated with key inputs will be identified. Input one is systematic and integrated approach to crowd management and site assessment. And activities within this input include festival organizers requiring to carry out a thorough hazard assessment and submit this to the local city councils, and a checklist will be prepared to ensure risk mitigation plans are consistent. In addition to that, a project database Festimate will be developed to help organizers liaise with LHDs, healthcare stakeholders, and ambulance services. Crowd management for events includes planning for adequate toilets, transportation of sick people, and food hygiene. The main outputs we're expecting to get from these input would be adequate planning and collaboration with stakeholders to minimize the likelihood of harms and to ensure that risk mitigation plans are in place if injury occurs. Number two, shade, heat, and cooling measures. In summer months, exposure to heat will be reduced to fans, air conditioning, misting stations, and shades. Water-resistant sunscreens with SPF 30 or above should be made available on site. Apart from that, provision of well-ventilated, quieter, and cooler spaces to rest and recover is essential, and free drinking water to be available at multiple easily accessible locations. And the outputs we are expecting from these include strategies to deal with risk of extreme weather conditions, dehydration, and exhaustion, so that they are in place if injury occurs. Number three, harm reduction messaging. Pre-event messaging will be sent through emails and festival apps. During the event, there will be posters and billboards highlighting the risk associated with health detrimental behaviors. And apart from that, we're also planning to put some brochures and menu cards in place depicting services available if injury occurs, and arrangement for harm reduction announcements between sets. Post-event messaging should be provided at exits, focusing on avoiding driving while tired or drunk. Peers will be involved in the design of health promotion programs to ensure messaging are tailored to the festival and resonate with audience. And the principal output from this would be that the patrons will be aware of the risk associated with health detrimental behavior in music festivals. Number four, peer-based alcohol and drug harm reduction strategies. Drug and alcohol support workers will rove around and chat to patrons about the presence of services, identifying patrons requiring attention and providing health education resources. They might also distribute sunscreens and water to or help people find lost partners. Referrals to support services can also be provided if patrons indicate an interest for behavioral change. They will also be involved in incident reporting and data collection to guide policy and action. And we are expecting this will result in effective engagement with patrons in delivering harm reduction information and services, and will ensure people who are injured receive medical attention sooner. And the final one, on-site medical service provision. Activities included within this input are assigned accessible and well-equipped first aid posts. And apart from that, an on-site medical center will manage medical presentations. New South Wales Health recommends the presence of an AHPRA registered medical practitioner, a trained doctor, a specialist critical care physician, a registered nurse, a paramedic, and an experienced first aid officer in every New South Wales Music Festival events. And the output is faster management of medical presentations on site. Now, we will quickly look at the evaluation procedure for the project. Evaluation will be carried out for the processes, impacts, and outcomes using data from multiple stakeholders and from project's dedicated database, Festimade. To evaluate the processes, stakeholder collaboration, tailored and effective service provision, communication, and data recording, accuracy will be assessed as seen on the screen. Apart from that, in the impact evaluation, the main focus would be on medical presentations and knowledge and awareness of the harms and injuries associated with music festivals. And the principal outcomes that the program is trying to achieve are three. Number one, reducing injuries at New South Wales music festivals. Number two, denormalization of health detrimental behaviors at events. And number three, compliance of event organizers with harm reduction guidelines. That's the end of my presentation today. Thanks for staying with me so far. If you have any questions or concerns, please feel free to email me in the address seen on screen.